Yep, 2:05.
Another 5 seconds more for YouTube Live. Jason, you have the link for YouTube on your WhatsApp.
Yeah, I
So
got it, sir. Yeah, I'll start sharing.
we can accommodate 100 people here maximum.
Yeah, I already told them.
Yeah,
So
okay.
they
Those
slowly.
who wish to, they can. So another 3 more minutes before you start, so they can decide whichever. But here they can interact directly with the speakers. Okay.
Good afternoon and welcome everyone. I'm Gitanjali and I'll be your MC for today. Today's talk is brought to you by Amsa Manipal about teenage pregnancy and baby dumping, why it happens and how it is handled in hospitals. According to CDC, in an interview from Dr. Nazali Hamza, a consultant pediatrician and past president of Malaysian Association for Adolescent Health, teenage pregnancy is a major cause of school dropouts, and out of every 3 babies, 2 end up dying at the rate of every 3 to 4 days. In regards to this, I would like to introduce our 3 speakers for today. Prof. Dr. Somu from the Department of Community Medicine with Masters of Public Health, Masters of Health Social Sciences, and Masters of Research, Higher Education. Dr. Gayatri Devi, an ONG specialist from Hospital Tengku Ampuan Rahimah, Klang. She attained her specialization from the Royal College of Obstetricians and Gynecologists. Dr. Gayatri Devi is also a Manipal alumni from Batch 9. Our third speaker for today is Dr. Naveen Kumar, a pediatric specialist in Hospital Malacca and a committee member of the Suspected Child Abuse and Neglect Team in Malacca. He attained his specialization from the Royal College of Pediatrics and Child Health. He is also a Manipal alumni from batch 4. Our kind speakers today have taken some time from their busy schedules to give us a rare insight into our topic today and how our hospitals operate. Following is a brief overview of how the session will be conducted today. The speakers will give a 15-minute talk, each on their prepared topics, and will be given a 1-minute reminder, and then we will proceed with the questions that we have collected. At any time, we ask the viewers do not interrupt the session. However, if you have any questions on any of our platforms, you can write it in the comments or chat box and we will get to them. And if we run out of time, the questions will be sent to the specialist and the answers will be posted on our social medias. This session will be streamed live on our social media and will be recorded, and pictures will be taken for documentation purposes. By attending this meeting, you have given your consent for recording and picture taking. And now, without further ado, our first speaker for today is Prof. Dr. Somu.
Okay, good afternoon, everyone. I hope you can see my first slide. Actually, first slide is the theme of the answer talk. Can you all see it?
Yes.
Yes, ma'am.
Yes.
Although the theme is there, I would like to highlight baby damping because from community perspective, the baby damping magnitude, cause, and prevention. So my top content will be what is baby damping, how common, why do baby were dumped, and how to help the society to avoid baby dumping. After my talk, I hope you can help your society to avoid baby dumping. So what is baby dumping? The parents have intention to terminate their care for the baby, and the baby should be less than 12 months, and the parents left the babies in the public or private places. Okay, that is the definition. But there's another word, child abandonment. Some of the literature alternately use child abandonment and the baby dumping. Some use the word infant abandonment. But actual technological term is child abandonment is the umbrella term because child is more than 12, child is included of baby dumping as well. Child abandonment include baby dumping as well. So that I would like to highlight here so that later when we see the data, you can realize our data are mixed up. Sometimes they use the word secret infant abandonment. So in some developed country, open abandonment is also there. Secret abandonment is also there. But what we are going to talk baby dumping in Malaysia, usually equivalent to secret infant abandonment. So how common is baby dumping? Can you all see those pictures? The cartoon? Are you all familiar with that cartoon? Right? So those cartoons related to abandoned children. It is in fairy tale. That means since ancient time, this baby abandonment has common. Baby dumping has common. However, what is the difference? Okay. In reality, it's very difficult to estimate baby dumping, right? Even in European countries, very few countries has national records. So according to those countries, so 3.6 per thousand live births per year in Romania, 3.3 in Slovakia, right? 1.7 in Poland, 1 in France. So average 4 to 7 infants per year, European countries. And you can see 60 million children in the world, that is abandoned children. For the world data, we don't have specific infant abandonment or dumping. 7,000 children per year in United States also abandoned children. And another thing is those numbers are the numbers those survive. You can see this on my right side. Those figures are tips of the iceberg. So there may be more cases, but we don't know. What about Malaysia? How common is baby dumping in Malaysia? So if you search in the Google, right, recently you can see this news in March 31st, it is happened in Malacca, right? And 2021 January, this year, early January, not long ago in Kuching, right? So December last year also we have cases, and it was estimated 9 babies dumped every month in Malaysia. So you can see when you search, many data are coming out. That means many cases, as well as we have done a lot, right? Malaysia has done a lot. Bear with me if you don't like the figures, but we love numbers. Okay, 2010 to 2016, total 697. 2015 to 2020, 652. But you will realize 2020, we have 6 months data only, right? Because of the COVID, maybe. So you can see we have been doing so much, but this 10 to last 5 years and this recent 5 years, not much change. Still, baby dumping is a problem. You can see different states have different numbers of baby dumping, but none of the state is free of baby dumping. So then we have to think, why do mothers and fathers, they dump their own babies? Okay, in this story, the parents abandoned the Superman to be child because this Krypton planet is going to be disappear. With goodwill, they abandon. But how often do you think a dumb baby will become someone like Superman? In reality, more than 50% of dumb baby were died. What about this? We are always talking about teenage girl whenever we have a dumping baby, but this story, she was abandoned by her stepmother. So I would like to highlight this kind of social problem can also lead to abandonment of the child. Those we are not talking too much about it. This one, we don't even know the reason why this baby was abandoned. Okay, but when we look at it, why abandoned? Because they don't want the baby. That means unwanted baby, unwanted pregnancy. So in some country, unwanted baby, but they do induce abortion. Or in our Asian country, we encourage counseling, social welfare services, so that this unwanted baby can be openly abandoned by their parents and good care by the institution, though it is not the best for the baby. So induced abortion not available, social service not available, sometimes social service available, but stigma is there, right? That will lead to, again, unwanted pregnancy and baby dumping, okay? So what I want to highlight is, before unwanted pregnancy, can't we do anything, right? Because unwanted pregnancy is the result of the unprotected or unsafe sex. Unwanted pregnancy is the result of accidental or casual sex, okay? So what can we do about it? So how to help your society? Just now, we already see this picture. If we can prevent unprotected and unsafe sex, if we can prevent accidental and casual sex, there won't be, and also the stigma from the society, misperceptions from the society, we can prevent unwanted pregnancy. If there is no unwanted baby, unwanted pregnancy, there is no baby dumping, okay? That I would like to convey to you, through you, I would like to convey to the community. So what we should do, right? The first step, prevent unprotected sex, promote safe sex practices. You can talk, right? Because you all have knowledge. If you don't have knowledge, you can search. You can prevent accidental casual sex and change the society perception. The first step, I do not tell much here because when you come to MCH, we will discuss, right? So medical student also discuss like this. Other discipline, even they know, right? This kind of safe motherhood and UN's SDG goal. What I would like to highlight here is this Maslow hierarchy of needs. I'm not talking about Maslow hierarchy of needs motivation theory, but I would like to highlight human needs, physiological needs, right? Physiological needs every human being has. You can see like food, drink, shelter, but actually this one, I purposely make the sex here. Sex is the human need. Every human has the drive, not necessarily teenage, but also adult men also have, adult lady also have, right? So if we don't aware of our psychological, physiological needs, right? Sometimes we will be trapped into and end up in accidental and casual sex. And another thing is love and belongingness needs, friendship, intimacy, receiving love and affection. For those child who do not have love and affection, they are more prone to have the relationship, boyfriend, girlfriend things earlier. And if they do not aware of the physiological needs, girls and boys in the quiet place, they can have a casual sex. That is not necessarily the teenage, any age. We have to be careful about it, and we have to send that message to the community. And another thing is, especially for Malaysia, we should change the society perception. We always say, oh, sex, that Western country interested, not us. But globalization make kids, our kids, early exposure to sex, not like us. So accept sex as a need for all human beings, and we must aware our child are equally exposed to the culture because of the globalization. Good parenting is also important, right? So love and affection needs as well as what your child is doing. And another thing is open discussion, right? When we were young, our parents do not make open discussion, but we need to do the open discussion, then only our children will open up, then we can prevent. Okay, so that is just the introduction. Later, maybe if you need to know more, we will discuss later in the question session. Okay, these are my references. Thank you very much. If you have questions, you can ask in the chat. I hope you can contribute by stop baby dumping. Thank you.
Thank you, Prof. Dr. Somu. Now I'd like to invite our next speaker, Dr. Gayatri Devi.
All right. A very good afternoon. I'm Dr. Gayatri. I will be speaking on teenage pregnancy in an obstetrician perspective. As an introduction, WHO defines teenage pregnancy as a pregnancy that occurs among adolescent girls aged 10 to 19 years. In Malaysia, evidence suggests that approximately 14 in every 1,000 underage Malaysian girls become pregnant each year. It is a complex issue and a serious problem worldwide. It not only has health problems, but also social problems. As we can see, based on MOH statistics in 2011, we had almost 19,000 of pregnant teenagers, and out of which more than 30% were unmarried. Based on the hospital that I work in between 2008 and 2012, we had an average of about 14% of pregnancy involving girls below 19 years old. In a year, we deliver almost 12,000 babies, and they contribute to almost 1,680 babies were born to girls below 19 years old. This is very alarming. In comparison to other countries, our rate is very much lower, but it actually doesn't reflect the actual figure because we have illegal dumping and abortion and also miscarriages. So what we see is actually the tip of the iceberg. A little bit on the statutory rape law in Malaysia. It says that any sexual intercourse with a girl under 16 years of age is considered rape irrespective of her consent. So as long as you're less than 16 years old, even if you consented for sex or you are pregnant, it is a rape. There are few risk factors contributing to teenage pregnancy. To begin with, our cultural practice. Some cultures in Malaysia encourages early marriage, which end up with a teenage pregnancy. Children born to teenage parents, they are at higher risk of being a teenage parent themselves. When you come from a social background such as domestic violence or a broken home, or if you have low education level, you're also at higher risk of teenage pregnancy. I've divided the risk associated with teenage pregnancy into 3 parts. Antenatal is while the teenager is pregnant, intrapartum is during labor, postpartum is after delivery. So in total, the teenage pregnancy affects the teenager in all ways. The teenager is higher risk of mortality, which means death. She can go into premature delivery. The child that the teenager is carrying is at risk of stillbirth. The education is interrupted, and the teenager also possesses a lot of health risk. Looking at antenatal, when she's pregnant, what happens? Late booking. What is late booking is they come for checkup very late. Ideally, a pregnant woman should come for checkup by 12 weeks. But what happened in these teenagers, they come late. Why? Because number one, they find out that they are pregnant very late. And number two, when they find out they are pregnant, they are scared. They don't know what to do. Some of them don't even come for checkup, and they only come when they are in labor. Second of all, they're at higher risk of anemia. Anemia is when your red blood cells are low in your blood. And if it's very severe, you may need blood transfusion. These teenagers are also at risk of premature delivery, which means you deliver before 37 weeks pregnancy. When the baby is premature, they are very fragile, they will require ICU admission, and there are many more further complications for the baby. Do not forget the mental health of a teenager because they are at risk of depression, and some of them may also have suicidal ideation. Sexually transmitted infections are common in this age group because they are unaware of safe sexual practices. They are also at higher risk of getting hypertension, and in worse form, they can have eclampsia, which means they can throw a fit, which can be life-threatening. The offsprings born to these teenagers tend to be smaller than how they should actually be. And when they be smaller, that will pose that the baby will require admission and further health complication for the baby. A little bit on consequences of unwanted pregnancy. So because these pregnancies are unwanted and unplanned, the teenager will try to get rid of this pregnancy. So how do they do it? They will buy medications, which they buy through social media, sometimes given to them by their boyfriends or even introduced by their friends. Some of them also go through procedures done by an untrained person, which can cause serious complication and can also be life-threatening. When they take these medications, they might end up having a miscarriage or even deliver at home and unattended. And some teenagers will have excessive bleeding and can cause life-threatening complications. And some of them even die because of this. And when they deliver baby, because they want to get rid of the evidence of the birth, they throw the baby away. A little bit of the law in Malaysia Abortion is legal in Malaysia under certain conditions, which is if the pregnancy poses a risk to the life of the pregnant woman, or continuing the pregnancy risk an injury to the mental or physical health of a pregnant woman, she can undergo an abortion legally, but it must be done by a certified medical practitioner. This is because there are many complications that arise from unsafe termination. The most important one is sepsis. Sepsis is infection. You can have an infection to your womb, which may end up losing your womb at a very young age, or you can bleed to death, and you can also have infection in the whole body. When you go through procedures that are done by untrained personnel, you can have a perforation to your womb where can in return injure your bowel and can cause serious life-threatening complications. When they are in labor, there are few things to look into. Generally, they can go through vaginal delivery, but some of them may need cesarean section because their pelvis is not fully formed yet. So they'll have obstructed labor and they would require a cesarean section. As we all know, labor is extremely painful. So it is important to give them adequate pain relief. Therefore, a referral must be done to the anesthetic team to choose the best option for her. And they are also at higher risk of mortality. Following delivery, they can undergo depression. That is because they cannot cope with a baby. They don't know how to take care of the baby. And because of the overwhelming responsibility and they want to get away with it, they end up throwing the baby away. And also the social stigma that they have to go through because they are looked down upon. So it is important they have a good social support for them. There are few things that we have to look at when we manage teenage pregnancy. In general, make sure they receive a non-judgmental and supportive care, a good social support, talk to her through the pregnancy. What are the things for her to expect? Involve her partner and the family as early as possible. Because this is an unplanned and unwanted pregnancy, it is important we sit and speak to the teenager what is her wish with regards to the pregnancy. Many of them may choose to continue the pregnancy, but some may opt to terminate. In an event she continues the pregnancy, she has always an option of giving the baby up for adoption, or she can keep their baby provided she has got a very good family support. When she's pregnant, advise her to go for a checkup as soon as possible because she will need an ultrasound scan to see how far into the pregnancy she is. Also advise her on balanced nutrition, and if she has habits such as smoking and alcohol consumption or even taking drugs, it's a good time to advise her and also tell her the side effects of it doing so in pregnancy. When the child is less than 16 years old, she will also require a social welfare referral and also give her information with regards to her antenatal care, how often her follow-up is going to be, what are the things to expect, what are the symptoms of labor, and in an event she goes into labor, what can be done for her. During the labor process, it is important for the parents to be around if she is less than 18 years old because consent becomes an issue. In an event she needs a cesarean section or blood transfusion or even an epidural, parents have to give the consent. Following delivery, assist her in breastfeeding and educate her how to take care of the baby. It is good time to speak to her about contraception and do not forget her mental health again. Assess her for postnatal depression. How do we prevent this teenage pregnancy? Of course, abstinence will be the 100% that you can prevent the pregnancy, but we all know it is impossible to do so. So there are few methods for contraception. The first one is oral contraceptive pills. It has to be taken over 21 days and 7 days pill-free and over the few cycle. But among teenagers, it has got very high failure rate because of compliance issue. The second one is an implanon. It is a medicated rod that is inserted just below the skin at the arm. It is very efficient in preventing pregnancy and it lasts for 3 years. The third one is injectable hormones. This has to be taken every 3 months. However, if you're less than 19 years old, it has got a risk to reduce your bone mineral density. Therefore, it should only be used when no other method is suitable. Do remember, all these 3 contraception does not protect you against sexually transmitted infection. The fourth one is the intrauterine device. It is a medicated device that is inserted into your womb. It can last 3 or 5 years depending on the kind that was used. It can also be used as an emergency contraception, which I will speak further later. Last but not least, the condom. It is cheap, it is easily available, it protects you against sexually transmitted infection. However, it has a very high failure rate when it comes to pregnancy. Therefore, it should always be used along with another contraception. What is emergency contraception? It is a contraception that can be taken within few hours to days when you have unprotected sex. We take it a time period of 5 days, which is 120 hours. So if you come within 72 hours of unprotected sex, which means 3 days, you can have this tablet called Escapel. It's a single tablet, but if your weight is more than 70 kilo or BMI more than 26, you will need 2 pills. If you come after 3 days, which means after 72 hours, but within 120 hours, which is 5 days, there are 2 options available. The first one is also a tablet. It is a single tablet. We call it Ella1. It is almost 95% effective in preventing pregnancy. The next option is an intrauterine device. If you have regular unprotected sexual intercourse, this will be a better option because it provides a reversible long-term contraception, which is about 3 to 5 years. So how do we prevent this teenage pregnancy? It is at multiple levels. WHO has mentioned that the leading cause of death among 15 to 19-year-old girls is pregnancy and childbirth complication. It's about time we take action now to prevent this. First of all, a comprehensive sex education in school. Most people shy away from discussing about it. Unfortunately, in Malaysia, it's rather disappointing, our sex education in school. We need to empower the teenagers with knowledge, not just the girls, but also the boys. And it's not just the basic biology where we say the girl has got a womb and the boy has got a penis. But we have to go more in detail and explain what is sex, what can happen when you have sex, how do you prevent pregnancy, and if you are pregnant, what can you do about it? Parental supervision is also very important. It is still a taboo to speak about sex in many homes in Malaysia, but we have to come out of the box. We have to actively and positively communicate with our children with regards to sex education and be open and honest to them. Tell them the ways to prevent pregnancy. Also instill religious education into them and keep track of your children's activity. In an event the teenager becomes pregnant, parents should acknowledge it and do the best for them. Instead of scolding and shouting at them, find the best method to deal with it. As for the government, they have many shelter homes across Malaysia. These homes actually accommodate to these teenage parents while they are pregnant to stay there. They even educate them and they also take care of them following delivery for some period of time. There are many good programs to increase public awareness, and they also have Baby Hatch in few states. So what is Baby Hatch? It actually offers mothers who do not want their babies a safe place to surrender their infants instead of abandoning them. So you just have to put the baby in the incubator and close the door, and they'll ring a bell and nobody would know who even put the baby in it. To conclude, I believe it is our duty to educate them and respect them and empower them. And with that, we can definitely prevent teenage pregnancies. With that, thank you very much.
Thank you, Doctor. Before we move on to our next speaker, there is a question about how the implant works.
So the implanon is a medicated rod which is inserted just below the skin. So it releases the hormone called progesterone, which prevents pregnancy. So that's how it works. It's basically a hormonal medication.
Okay. Thank you, Dr. Gayatri Devi, for a very informative talk. Now I'd like to invite our third speaker for today, Dr. Naveen Kumar.
Thank you, Madam Chairperson. So we've heard two excellent talks. I will now offer a pediatric perspective of these two problems. Okay, it's sharing.
Yes, Doctor.
Okay, so a small disclaimer before I start. Unless stated otherwise, a lot of the facts here are my own personal opinions and views that do not necessarily reflect the official government policies. With that, I will proceed. So by definition, teenage and adolescent pregnancies mean any pregnancy in a woman aged 10 to 19 years old. And I won't go too much into the statistics. I think that's been covered already, but just know that the numbers are increasing, the numbers are alarming. And as we can see from these Banama infographics, a large number is actually contributed by married teenagers. And if we go by prevalence among states, you see Sarawak is one of the highest. And how we're doing worldwide in this world map, you can see that we're actually, okay, we're bad, but African nations seem to be faring worse. What are the risk factors? Culture. Certain cultures are more accepting of teenage pregnancies, more accepting of teenage wedding, marrying them off earlier. Family support is an important factor here, where certain families are not very supportive of their children, tend to marry them off earlier. A poor socio-economic background. Sexual practices, of course, if younger teenagers practice earlier sex, they tend to fall pregnant more often. Alcohol and drug abuse, as well as some of them are actually victims of sexual abuse themselves. So that's an important thing to consider. And locally, there are a lot of, there have been lots of surveys and studies. They point to poverty as one of the reasons. People from a lower economic background tend to fall pregnant earlier, get pregnant earlier. Lack of parental supervision. So a lot of these pregnant mothers, when interviewed, we realized that they've been left alone to their own devices with no parents actually supervising them. There's lack of parental contact with them. Poor academic achievers. Now this is a vicious cycle. So the poor achievers tend to get pregnant earlier. And when they get pregnant earlier, they tend to stop their studies at that point. So lack of sex education, as Dr. Gayatri mentioned, sex education in Malaysia doesn't really go into much of the dynamics. It's more of anatomy and physiology. Peer influence, when their friends are doing it, they tend to do it themselves, and premarital sexual practice, of course. And more important for me, effects on the baby. Up to a quarter of these teenage mothers end up with premature babies or small for gestational age, low birth weights. So this comes with its own group of problems of morbidities and higher mortality rates. Of course, when the pregnancy is unwanted, they're at risk of being dumped or even having abortions done, whether legally or illegally. Because they're so scared of approaching antenatal care, they don't get, problems don't get picked up early. So as a result, the baby suffers. And these babies later on will they encounter developmental behavioral issues, psychosocial issues, and a large number of them are actually unwanted. So the mothers tend to pay less attention to them, so there's less emotional stimuli. They are prone for abuse themselves. They tend to perform poor academically, and weirdly, a lot of them end up having their own teenage pregnancies later on, and a life of crime, a higher risk of a life of crime. So I think I agree with Prof. So wholeheartedly. Prevention is the key here, rather than try and tackle the issue once it's already happened. Education is very important. We need to give them very good education, sex education, teach them the role of contraception. A lot of surveys, there was one survey that was done recently, shows a very alarming rate of awareness among our teenagers about contraception. In fact, contraception remains a very taboo topic. Even as adults, I think a lot of us would hesitate to walk into a pharmacy and purchase a pack of condoms. So I think if we find it that difficult, our teenagers are going to find it very difficult. And parents tend to shy away from their role of talking to their kids about sex. Public policy as well, how teenage mothers are viewed as a problem rather than as someone to help. And tackling socio-economic factors will also indirectly help with this whole issue as a whole. About management, working in pediatrics, we have a unique perspective of actually treating the mother and the child together. So it's actually quite interesting. Even before the baby is born, good unbiased. Now I highlight unbiased because a lot of these teenagers are actually very, very scared to approach primary healthcare. They are looked down on, they are frowned on, they have very biased opinions, and people are very vocal about it. So I don't blame them actually for not approaching us earlier. And even once the baby is born, like Dr. Gayatri said, good postnatal support, teach them on breastfeeding, teach them how to raise their kids, how to look after, because they're kids themselves. All teenage mothers are referred to social services, so Jabatan Kebajikan, as well as Pelindung. Now, Pelindung, gazetted, especially gazetted welfare officers, who can enact the Child Act. They can enforce the Child Act. Good counseling to mother as well as the family members, because a lot of times there's a lot of intrafamilial issues, and we carefully review each case to ensure there's no element of abuse. Even though the teenage mother may claim that it's consensual, there's actually no consent below the age of 16. And someone may have abused their position of power. Good support, and then again continuous education to make sure that they don't go on to have further pregnancies too early. Now, what about baby dumping or child abandonment? The cases, okay, so it's largely agreed that these cases are hugely unreported. Okay, as both our presenters said before this, it's just the tip of the iceberg. A lot of them are undiscovered, unfortunately. So you can see that the numbers are alarming. I think we all had the same Google search, so you would have seen this slide a few times before. The numbers are there, and these are a few of the local cases that happen. You know, babies being thrown out of the windows, babies being found in the bushes. Some babies actually have a note, tolong jaga budak ni. Why does it happen? Poverty again, low socioeconomic groups not fund their pregnancies. In fact, domestic violence is prevalent. Cultural, social, and religious stigma. Now in Malaysia, this seems to be a major problem because if they get pregnant, it's an unwanted pregnancy. Sorry, I think there's some feedback. Okay, if it's an unwanted pregnancy, they face a lot of stigma. They don't know where to turn to. So you can imagine how desperate a mother has to be that she has to throw her own baby away. So this is the amount of stigma that she faces, the amount of obstacles that she faces. When the pregnancy is not planned, the baby's got a high risk of being dumped. When the family itself does not support them, and again, unsafe sex practices, which would lead on to unwanted pregnancies. What does this mean to the baby? Now, in Malaysia, it's actually very, very common. Once every 3 to 4 days, a baby is dumped. And the chances of the baby is very slim. 64% are found dead. Now, I highlight the word found because these are the ones actually found. There are a lot of babies we estimate are not found at all. Bearing to our geographical locations, especially in the interiors. Severe impairment, a lot of them have unassisted births, so we don't know how hypoxic or compromised they may be when they're born. The mothers, when they are found, they end up being criminalized and separated from the babies. I put in brackets sometimes father because the dudes almost always get away. They leave the mother to deal with this issue herself. And these babies end up institutionalized, which is another big problem in itself. They will end up being in a welfare home, orphanage. And because there's no ties, this baby is deprived of his heritage, any medical history, and some of them actually end up stateless. And later on, those that grew up, when they find out about this, they have issues of abandonment. So again, I will highlight on prevention, which is the most important part. Educate these mothers, educate the public, highlight the use of contraception, prevent the unwanted pregnancy before it happens. And parents, yeah, it is very disappointing, but if the parental support is there, these mothers tend to fare much better, and as a result, the babies are safe. And some public policies, some countries adopt a safe haven approach where mothers who do not want their pregnancy, they are treated fairly and they are being given anonymous, um, um, they're being treated well and they're not criminalized, as well as improving socioeconomic factors. Yes, it's copy pasted from the earlier slide because the issues and the factors are still the same. And I'll talk a little bit about baby hatch. Now, baby hatch, the concept is actually not something new. It's been around since the 12th century. I think in churches in Europe, they had something called a founding wheel, where they would deposit the baby and turn the wheel and the baby goes inside, where it's safe from the elements. This concept was actually initially started by Orphan Care. It was a non-profit NGO. It's now a foundation. And they opened the first baby hatch in 2010. Now they run 3 baby hatches in PJ, JB, and Sungai Petani, with 8 more run by the KPJ group. So total, I think the number is more, but what I got from the website is 150 babies have been saved and 87 mothers counseled. So you can see here an example of the baby hatch where the baby is placed in the hatch, the door is closed and an alarm bell is sounded and the baby is then safe. And there's no cameras outside, the cameras on the inside to show that the baby is there. So the mother is guaranteed anonymity. On the other hand, you see this pink bedroom where mothers can choose to remain with the babies for a while, be counseled on adoption policies and options. So when we are presented with those babies that do survive who are abandoned, first thing is assessment and stabilization. Some of them have actually come to us in quite bad shape, badly bitten by insects, dehydrated, septic, scratches all over, a very bad situation sometimes. So we stabilize them as best we can. We assess them. We attempt to age them. So in newborns, we try and guess the gestational age by scoring. We look at the cord. We look at the skin. Slightly older infants, we try and attempt to age them. We take blood samples as necessary. So these are first and foremost to rule out infection, the normal newborn screening, and sometimes the police will actually ask us to take DNA, especially if they can track down the mother. Most of them need antibiotics because they've been exposed to unsanitary, unhygienic conditions. Passive and active immunization, so the normal routine immunization is given, as well as if the cord is not cleanly cut, they will need tetanus passive immunization, and we give them antibodies. A police report is done to report the finding of a baby, and again referred to social services. This will be our Jabatan Kebajikan, our medical social worker, as well as the child protector. So the child protector would then go on to make every effort to locate family or next of kin. If that's not possible, then this baby will be institutionalized and they will try and get the baby registered and get them adopted by a good family. So the important thing is managing either the baby or if the mother is found non-judgmental and non-biased and compassionate. And that's the end of my talk. Thank you for listening.
Thank you, Dr. Naveen, for the insightful talk. Now we shall move on to our Q&A session. We have a question from our viewer. The first question is, as a medical student specifically, when we encounter teenage pregnancy in clinic, kesihatan, or hospital, what is the best advice that we should give to the mother? Dr. Gayatri, can we know your thoughts on this?
All right. First of all, when we counsel them, we have to be friendly. It should be in non-judgmental way. We must gain the trust of the teenager and explain to her the importance of follow-up and encourage her to come for follow-up and explain to her that, you know, she's not alone in this. We are all here to help her and facilitate her and advise her on her nutrition and her supplements and take care of her mental health well-being too at the same time.
Thank you, Dr. Gayatri. Our next question from our viewer is, do abandoned babies take on nationality of the host country? Dr. Naveen, do you have what are your opinions on this?
Okay, there's a lot of polarizing views in that one. So my personal experience, yes, because our Jabatan Kebajikan, they actually try to expedite this and they deal with the National Registration Department, and quite a few of them do end up citizens. Although there have been cases where some of them end up stateless and there are a lot of issues about this, but yes, they can get citizenship.
Our next question is directed to Prof. Somo. What is the biggest problem associated with teen pregnancy and what is being done about it? Prof, you have to unmute your audio. Okay.
Okay, from our perspective is just now all of the speaker have also mentioned getting data is very difficult. Like WHO mentioned, right, 12 million, but as other speaker also mentioned, that is the tip of the iceberg. The most difficult part is actual data, getting the actual data on teenage pregnancy as well as baby dumping. That's very difficult. When we know the actual data, it is very helpful to advocate for the policy as well as getting the budget as well as getting the service. So because of tips of the iceberg only, so what we get, what we advocate for, we use the data is small number, not actual number.
Prof, how is the stigma about it now compared to the last time? And is there any improvements that you think that should be made?
Okay, that's a very good question as well as very difficult question, because just now when I present, right, even for the global data, we don't have, even for the data, we don't have an accurate one. So stigma is qualitative data, more difficult. And for the trend, because we have done a lot from the professional, we thought, right, or stigma has reduced, but it depends, right? Just now, 10 years, the first 5 years and the later 5 years also, baby dumping is the number is same, right? And those people who stick the stigma, like for example, for other people, maybe your stigma has reduced. If it comes to someone who close to your people, maybe you don't want to reveal it, right? We cannot say, or if like, for example, my relatives have this issue, maybe we don't want to reveal it, right? So that the stigma, each and every individual case, it's different. So if we can say reduce, okay, sudden reduce, but it can be either way, because stigma is, very difficult perspective. Despite we have a lot of education, we still have stigma. That's the reason we still have a similar number of cases going on.
Okay, thank you, Prof. The next question that we have is, do most teenage parents keep their newborn? Dr. Naveen, what are your thoughts about this?
Okay, a lot of the literature that I've got seems to state about 50-50, about half of them tend to keep their babies and half give them up for adoption. But in my own personal experience, most of the teenagers that I've dealt with, most of them tend to want to keep their babies after adequate counseling and talking to them about everything, the pros and the cons. Most of them tend to want to keep their babies, yeah, with support, with adequate support.
Our next question from our viewer is, what are your suggestions on effectively increasing the awareness of sexual and reproductive health in society? Dr. Gayatri?
Sorry, can you repeat the question?
Your suggestions on effectively increasing the awareness of sexual and reproductive health in society.
Of course, first and foremost, sexual education in school. And then we have many programs that they all can listen to, like the current one that we are having, and also awareness from the parents themselves at home to begin with.
Thank you, Dr. Gayatri. Another question directed to Dr. Gayatri also. How does management of teen pregnancy differ from non-teen pregnancy?
Okay, in teenagers, right, their body is not fully developed. Therefore, the body is not ready to embark on a pregnancy itself. So they have higher risk of certain problems in pregnancy where we have to look out for. And following delivery, we have to take care of the welfare of the teenager and also the baby also. And also we have to facilitate the teenagers to go back to school as soon as she can. So this differs from an adult who delivers.
And also, what are the important points to cover in teenage pregnancy counseling?
Oh, as I mentioned earlier, of course, explain to her the importance for follow-up and the nutrition, the supplements, and make her feel welcome. Make sure you give her the reassurance she's not on it alone. She has the support of many groups, and also advise her on contraception, which is very important, and also give her positive mental feedback and take care of her mental health also at the same time.
Next question is directed to Dr. Naveen. They're wondering who takes care of the child in the hospital if somebody leaves a baby in the hospital and runs away.
We do. So if the parents abscond, you're talking about if the parents leave the child in the hospital and run away, right?
Yes.
Yeah. So it ends up being all of us, from the nurses to the doctors, every staff pitches in and helps to take care until we either find the next of kin or a suitable home for them.
Thank you. Our next question is, why is sex a taboo topic in Malaysia? Dr. Naveen.
I think it starts right from our childhood. I don't remember having the talk with my parents. I'm sure a lot of parents now don't have the talk with their kids. And oh wait, no, in my parents' defense, they did try. So I think we can only improve from here. We improve the way we talk to our children, bring them up and try and children learn from us. They tend to imprint on parents. So if we, for instance, if you're scared of a cockroach, for no reason, they're not harmful, but the kids end up being scared of cockroaches. So same way, if we are shy of a certain topic, they end up being shy of the topic, and that is just brought on from generation to generation. So we have to start somewhere.
Thank you, Dr. Naveen. Our next question is, are condoms given free in Malaysia, and why aren't people taking them? This question is directed to Prof. Somo.
In our clinic Kasihatan, they give the condom free of charge. But the problem is the way we give is, okay, one woman family planning counseling, and they have to tell, right, that the decision is about condom. If they want to use condom, husband participation is very important, right? Sometimes women come, most of the women come to the KK alone. So they are not quite sure unless they even pre-discuss with the husband. So most of the time they choose the other method, despite every method's free of charge except the implant. And another thing is, okay, both husband and wife come. They want to use the condom, we provide. How we provide? 12 condoms per pack we provide, right? They went back. After that, if they want some more, right? How can they come and ask? They feel shy. But in India, this condom is available in machine. So whoever wants, they just take it. But there's advantages and disadvantages. India style provision of free condom, we don't have data. They don't get data. Who is actually using it? Even though 100 condoms, 1,000 condoms consumed, we are not quite sure how many people are using it, right? But in our system, we know who is using it, how many have been taken. But for example, how often do they come back and ask for the free condom? Okay, so we have to tell them condom can be available in the supermarket as well. But supermarket near the cashier, they always keep, right, the condom. So near the cashier, there's a long queue. You are taking the condom, everyone is seeing, so they feel shy, right? So that's why I say people's perspective, society perspective. If toothbrush and toothpaste near them, right? So strepsil is them, we don't mind taking it, right? But since community perception is, oh, it's a child, people might think I'm very sexually active, that kind of thing. That's why they don't take. Not to say come to the KK, oh, I need more condom. So they are very shy to say that. Okay.
Yes.
Can I answer your
Thank you.
question?
Yes, yes, Prof. Our next question is directed to Dr. Taichi. And they said in hospital notes, we often see extramarital pregnancy mentioned in the case notes. Do you think it is good, more good than bad? And in regard to stigma, the attitude they get from medical and non-medical personnel who can see the notes?
Personally, I think it should not be written because whether it's an extramarital or not, it is not important. What is important is they came for follow-up, they came for treatment, and they got the correct management for the pregnancy, and she is well taken care. That is more important than whether she had the pregnancy before her marriage or after her marriage. It really doesn't matter, but as long as the baby and the mother is well taken care, that is the most important thing.
Thank you, Dr. Taichi. The next question is, in the case where the mother is a victim of sexual abuse, how does the treatment vary from a teen mother who is pregnant due to consensual intercourse?
If it is from a sexual abuse, which means it is a rape, so she has an option of having an abortion depending on how far into the pregnancy she is in. Sometimes if it's very advanced in pregnancy, we may not be able to terminate the pregnancy because it imposes risk to the mother. So she can continue and deliver the baby, and the baby can be given up for adoption.
Our next question is, if a teenager requests to have an implant or an IUCD, does she need to have parental consent?
Unfortunately, in Malaysia, yes. But of course, we can have a discussion and choose the best available method that can prevent pregnancy for her. Unlike in UK, if you're less than 16, they can get access to contraception. But however, in Malaysia, we still have to improve on the needs for contraception in these underage girls.
Thank you, Dr. Kaitri. Our next question is directed to Dr. Naveen. Many of the methods of prevention are focused on the female perspective. What can the men in our society do to tackle teenage pregnancy as well as baby dumping?
Just don't do it, I guess. Yeah, you're quite right. Actually, a lot of times the males are not responsible. And in most of the cases that I deal with, they're not around. They don't take responsibility over it. So I think it boils down to the individual. If the male has a sense of responsibility over his actions, then they will stick around and they will make sure that whatever the outcome, they are around and they're there supportive of their partners.
Thank you, Dr. Naveen. Our next question is, what counseling is done for single mothers? Dr. Kaitri, when thoughts on this?
Counseling for single mothers when they are underage, or okay, if you look at single mother per se counseling, if they are less than 16 years old, we activate SCAN team, which means it comprises of few teams who will take care of the teenager, where we have the psychiatry team, we have the pediatric team, we have social welfare team to help us to manage the teenager. counseling per se, we have to find out what does she want to do with the baby after it delivers. Does she want to take care of the baby? Does she have a good family support? Or does she want to give for adoption? These are the things that few consideration that we have to look into when we speak to them per se.
Thank you, Dr. Gayatri. Our next question is, what age specifically would be appropriate to give sexual education? Prof, Dr. Samu, do you have any opinions on it?
Okay, when we say sexual education, people are thinking about sexual intercourse. Actually, sex education can start from just now, the Gayatri also talked, right? So the Dr. Navin also talked. Sex education can start from very young at home before going to preschool also. What to say? We say, sometimes people ask, how I was come out to this world? The parents will say like a fairy tale from this, from that. They didn't say, you come from my womb, right? You stay in my womb for 9 months. So we should tell the truth. And then there's a one YouTube cartoon as well. So the baby asks, right? How can you reach to your womb? So they have to simplify and say, right? So that 2% is necessary from the young, 2% is necessary to form a human being, right? So with that, we have to start. So there is no age limit for sexual education, as long as the child start to learn something, right? So we start to tell it, right? So 3 years old, when they ask about, sometime during the shower time, why they have this penis, why I don't have, if the girl asks, right? At that time also we can say, yes, there are different things. Later you will know the purpose of those organs, right? So sometimes the parents shy to say, do not prepare to say, because children are learning, right? When the young girl, 3 years old, and young boy, 4 years old, together shower by the parents, they ask questions. But at the time, parents not ready to tell the truth. So from the young, we have to let them know they are different people. These two people can form another human being. And you will notice nowadays in the primary school education also, they start to have a lessons like lifestyle experiences. And they even say, okay, girls, do not allow the people to touch your body parts. What is private parts? So that is also part of the sex education. And another thing is love and affectionate needs, courtship, those are also part of the sex education. It's not that sexual intercourse alone. That's why sex education, we have to take the opportunity and we give the information slowly. For that, parents' participation is very important.
Prof, do you think the education system is heavily biased towards women being more responsible when it comes to sex compared to men?
From the professional perspective, they are aware since 2000 or earlier time, they are aware men's role in prevention of the pregnancy as well as unwanted pregnancy and baby dumping. Because 2000, I have attended one conference, right? So that conference emphasized change of the concept of the men. What they say is, usually at that period, men say, if you propose girl, the girl say no, actually equal to yes. So that kind of perception, they try to change. There's even one song, if a girl say no, it is really no. Respect to the girls. So just now you can see sustainable development goal also equity, gender equity, as well as respect for girls and ladies, and education for all, education for girl child also. Previously, girl has less education, access to less education. right? So those kind of things, global level, they try to change, right? They try to change. So, but still, right? When you look at the newspaper, arrested, tracing for the mother, so they still call for not punish the mother, not blame the mother. So that means the blaming is going on in the society. Okay? But actually, to form a baby, the sperm and the ovum should meet, right? So both are responsible.
Thank you, Prof. Our next question is, what is a safe way for parents to dump babies? Dr. Naveen, do you have any thoughts on this?
Safe way of dumping their babies would be, I think, utilizing the baby hatches. There are, I think, 12 or 13 nationwide. There's a lot of resistance to more being built, but just know that there are safe avenues. Orphan care is a very good place to start. I'm actually very impressed by the work that they've done. So they've got toll-free numbers, they've got email addresses. I think even their website, you can just leave a message and they will contact you back. And they offer anonymity, they are non-judgmental, very unbiased, and they will help to guide you. So they've covered pretty much northern area, central area, and southern area. Sabah, Sarawak, not yet. But I think KPG, if I'm not mistaken, has covered that area. So there are a lot of avenues. It's just that awareness of these avenues are not there.
Thank you, Dr. Naveen. Now we'll move on to the myths about pregnancy. Some have said that they have heard eating fish and sesame oil is very good for pregnancy. What do you think about this, Dr. Gayatri?
Basically, our daily food intake has got all the nutrition that we have. And if you take it in a balanced way, of course, the nutrition is enough. But in an event you want to take an additional supplement, there is no harm in it.
Now move on to our panel questions. Be ready with your I agree and disagree. Our first question is, do you think that we should restrict the access of porn below the age of 21 in Malaysia?
It's a very controversial question.
Personal opinion only. I'm not commenting on official. I think no. I think parents are the key factor here. It should not be the government that decides what, because children are going to find a way to overcome any barriers or any firewalls you put. I can tell you that much. They've got VPNs, they've got DNSs, they know how to overcome whatever firewalls you put. So the parents are the ones who have to monitor what's happening with their gadgets, with their computers.
Dr. Gayatri and Prof, do you have any other opinions on this?
No, I agree that they should be monitored of what they are watching. And of course, parents play an important role. Sometimes they even have peer pressure to do so and watch it. And so it all depends how we take it.
Prof?
Yeah, in this globalized world, it's difficult to restrict. Even though you restrict, right, they have many ways to assess. So don't do, instead of saying don't do, right? So what will be the consequences? If you look at the porn picture, right? If you participate in intimate relation, what will happen? The consequences. How to reduce the consequences, rather than don't do this, don't do that. My personal opinion.
Thank you, Prof. Next question is it the fault of parents for not being vigilant enough with their children, thus leading to early sexual behaviors? I think you have answered this earlier. So,
I also disagree.
can we know your opinions on this, Prof?
Yeah,
Why do you?
because it's we cannot say it's parents, because parents also, they have their own struggle, right? So for their living, earning, and their work, many things, right? But we just need to, instead of who is responsible, we try to do whatever we can, right? So, like for example, in our country, we always remind, hey, your daughter posts something in the Facebook, right? So we have to network other people as well, not necessarily parents. The whole society should help the children, right? So when we was young, if we do something wrong, our neighbor will tell, hey, don't do that. But nowadays, what I notice is, if we stay in condo, we don't even notice who is our neighbor, right? So that kind of social networking, social cohesiveness also important, rather than parents alone.
Dr. Gayatri, do you have anything to add on why you disagree?
Because I believe some parents would have done their best to, give the education and explain to them. But it's not solely their fault when this thing happens, because there are other external causes and factors that contribute to this teenage pregnancy also. So I do not blame the parents solely for being the reason for this to happen.
Thank you. Thank you, Dr. Gayatri. Dr. Naveen, is there anything you would like to add?
No, I concur. I think everyone plays an equal role.
We shall move on to our next question. Do you think that the government should provide a facility or baby dumping instead of charities, or will this lead to more cases of baby dumping?
Can you repeat?
Should the government provide a facility or a place for baby dumping instead of charities, or will this cause more cases to come up?
Your question has two things, right? Two perspectives, right?
Yeah.
So the first perspective, I agree, because government should provide facilities for dumping, because we've tried to prevent dumping, but once situation is happened to be dumped, to make the baby safe, like just now mentioned, right? So baby box or baby hatches, if the government provide like this, government or NGO, whoever provide, the more the better to save the life, right? But another thing, by providing this, will it increase the more baby dumping? That I disagree. Reported baby dumping may be increased, but it may not be the actual number of baby dumping. Baby dumping we will be going on, right? But once we have more safe receive box or hatches for dump baby, then we will get the higher reported number of dump baby. But in my personal opinion, not necessarily it will increase, stimulate them to dump.
Dr. Kaiji, do you have anything to add to it?
No, I agree with Prof. I think we should have a place for them to leave the babies instead of dumping them nowhere. And I totally agree with her.
Dr. Naveen, what are your opinions on this?
It's actually a double-edged sword. Yes, we do need baby hatches, but at the same time, there's a lot of arguments against increasing the number of baby hatches, and instead we should be focusing our efforts on preventing baby dumping from happening in the first place. There's a lot of arguments actually against baby dumping, quoting the Child Act, the UN Conventions on the Right of the Child, to not be dumped. So I think we should focus on preventing rather than involving. But having said that, we have the facilities to be more welcoming. For instance, our EDs or emergency departments actually have very safe areas to handle OSCC or scan cases. So facilities are there. It's just that we have to remain open and unbiased to mothers who want to come and leave the babies with us.
Moving on to our next question. This question is quite controversial. Do you think that if other forms of sexual intercourse other than vaginal were to be legal, the rates of baby dumping would drop?
What do
You
you
have
mean
to
by
have
legal?
vaginal sexual intercourse to get pregnant to begin with. So I'm not sure how other ways is. You definitely not going to get pregnant by other ways.
I think what you should focus on is good sex education. If you look at, I won't name countries, but if you look at more open countries, they don't just focus on sex as in, oh, penis goes inside here, and they focus on how both parties can fulfill enjoy each other in this company without having the risk of being pregnant. As an example, instead of allowing or saying this is legal or illegal, I think the way we educate our kids.
Just now, I want to know the question. The other form of sexual act should be legalized or illegalized. So what do you mean by other form of sexual act? Like man-to-man sex or lesbian sex? Is it?
I think that is what they meant.
So those kind of man-to-man and the lesbian things, we are worried about the HIV rather than pregnancy and baby damping, right? Whether it should be legalized. If legalized, they can be identified, so we can do the preventive measure. That most of the time is HIV prevention, sexually transmitted disease prevention, right? But other form, like fondling or foreplay, that is between two parties, and we don't even notice, right? To be say legal or illegal, right? That is in the private domain only, right? But if you say it is a gay sex, gay marriage, lesbian sex, lesbian marriage, that is more for, we worry more concerned for HIV and STDs rather than pregnancy. Am I answer your question?
Yes, sir. I think we shall end the question and answer session here. Thank you, everyone, for participating in this discussion. The remaining questions will be sent to the specialists and the answers will be posted on our social media. And now we shall proceed with the picture taking session. All the participants are required to turn on their webcam. Okay, everyone, please pause for the screenshots.
Still, quite a few people have not on their camera actually. You want to wait or go ahead, Kason?
Yeah, I think, yeah, go ahead. Oh no, wait, new ones are coming now. Just keep taking the photos. Oh. Yeah, I think we can take now.
All right, smile everyone. We'll be taking few shots. Okay, so 3, 2, 1. One more, we have multiple screens here. So keep smiling. Right, one more. Done. Thank you, everyone.
Thank you. Thank you.
Thank you, everyone. Now, I would like our head of AMSA Manipal, Mr. Kason Ui, to give the word of thanks.
Thank you, Ms. Gitanjali. So, first and foremost, on behalf of AMSA Manipal, I would like to express our gratitude to our speakers today, Prof. Dr. Somo, Dr. Gayatri Devi, and Dr. Navi Kumar for taking up time from their busy schedule to share their expertise and experience with us today. Secondly, I want to give a big thank you to our team and our advisor, Prof. Dr. Som Subrade, for organizing our event today. And also a special thanks to University Malaysia Sabah for joining in on our session today. And also finally to our viewers, I'd like to thank you guys for your time today, and we hope that you learn some new information and return with it. As said earlier, those that would still like to ask their questions still can ask those questions with our social media such as AMSA MUCM in Facebook or Instagram. And if anything, you can send it to our email that is listed in the promo message earlier. Once again, I thank all of you guys for attending. This event was brought to you by the Asian Medical Student Association of Manipal with the help of Manipal University College Malaysia. Thank you very much, everyone.
Thank you.